Hello dear viewers, I am Dr. Sunil Garg and in this video I will be discussing part 1 of ventilator graphics. What is ventilator graphics, how it is useful for healthcare professionals working in critical care settings to know about them, and what are the different types of ventilator graphics. Ventilator graphics are waveform or graphical presentation of ventilator, patient and their interaction to each other. So why it is necessary for you to know about it? If you are working with critically ill patients, it is important to know how to read these graphics since it helps in allowing users to interpret, evaluate and troubleshoot the ventilator and the patient response to ventilator. For example, if there is a leak in the endotracheal tube balloon, you can recognize problem while looking at graphics. It helps in monitoring the patient's disease status, like you can check compliance of the respiratory system and airway resistance. Patient response to therapy can be assessed, and it also allows fine tuning of the ventilator to decrease work of breathing, optimize ventilation and maximize patient comfort. There are two types of ventilator graphics. One is scalar, which is plotting of one of the parameters against time. Parameter can be volume, pressure or flow, and time is on x-axis while parameter is on y-axis. Another is loop. In loops there is plotting of the volume, pressure and flow against each other. Means two components against each other and there is no time component in loops. There are six basic scalar waveforms. Square means constant value over time. Ascending ramp means gradual increase in value over time. Descending ramp means gradual decrease in value over time. Sinusoidal mimic the shape of a sine wave, indicating a smooth repetitive oscillation. It is seen with the spontaneous unsupported breathing. Exponential rising shows a sharp increase followed by a gradual plateau. Exponential decaying displays a sharp initial value that decreases exponentially. Generally, ascending and descending ramps are considered same as the exponential ramps, means exponential rising as ascending ramp and exponential decaying as descending ramp. Now we know there are six basic scalar waveform, but how the shape of these basic scalar waveform is determined? The specific mode of ventilation and the patient's respiratory mechanics dictate the shape of each scalar waveform, means whether mode is volume or pressure, and patient's respiratory mechanics, which depends on underlying lung disease state, will determine the shape. Pressure time waveform is mainly square and exponential rise. Volume time waveform ascending ramp or sinusoidal, reflecting changes in the lung volume, and flow time waveform vary more widely and of descending ramp, square, ascending ramp, sinusoidal and exponential decay shapes, each illustrating different flow characteristics through the respiratory cycle. Here you can see different scalar waveform of pressure time, flow time and volume time. You can see this is y-axis and this is x-axis. On the y-axis there is pressure, on the x-axis there is time. From the very beginning the pressure is highest and it remains constant with the passage of time. So during square wave or rectangular shape waveform value remains constant. Similarly you can see there is exponential rise. This is volume, you can see this is ascending ramp, this is sinusoidal, this is descending ramp pattern and this is exponential decay. Remember, shapes depend on mode of mechanical ventilation and patient's respiratory mechanics. Here I finish. In my next video, I will continue the same topic as part 2 on ventilator graphics. If you have any comments, feedback or suggestion, please write it down in comment section. Till then, bye and take care.